Right, welcome back. Now, in the last video with Aaron, we were obviously looking at the long-headed biceps dysfunction that he had, but I think it's really important that we keep in mind too some of these postural dysfunctions that we'll see in and around the shoulder. And this is something that's not really new, but what we can see is a lot of the time this anterior structures here start to become dominant, and obviously they become short and tight as well, whereas obviously this is all this posterior rotator cuff, you know, the traps and so forth, even the scap stabilizers become weak, and that obviously becomes a real battle between these muscle groups. So I thought what might be really informative is if we take the time and actually look and see what sort of soft tissue techniques that we can do to try and free up some of this dominant tissue through here, especially the anterior of, say, maybe the pec minor and the pec major as well. And keep in mind that pec minor is really important because we do have the brachial plexus just coming underneath that. So if that does get short, tight and dominant, obviously it can compress on there, give us a little bit of anterior shoulder pain. God forbid it starts to give us some secondary entrapment as well, which is not ideal, especially for someone who's trying to hang off a cliff face like Aaron. So let's get you back down, Aaron. We'll have a look and see how some of these techniques can work. So just pop that arm up there. Okay, so we've been very lucky because Aaron's decided to shave for us today. So I'm very happy about that, because the one enemy to these release techniques is the fact that we do have a really hairy chest. So if we can, especially with our male clients, it's really important that we obviously try and have a hair-free environment. Okay, so I'm just going to apply a little bit of the cream. Once again, we're going to use a bit of this cream. Just going to pick up the bulk of the pec, and then I'm going to come underneath the pec major and then pick up and engage with the pec minor. Okay, so really simple. We can use passive release techniques. You know how much of a fan I am of passive release techniques, primarily because you get to challenge the tissue and you can really open up some of that really restricted and dominant tissue. So probably best pick up at the elbow, because if you pick up here, then obviously you've got the wrist to worry about here and obviously the elbow itself. So I tend to find if I can pick it up at the elbow here, then I've got full control of the whole arm. So two steps to this. The first one will be we're going to engage into the tissue of the pec major. So we're going to sink down into the tissue, okay? Drop the shoulder down, and as we do that, I'm just going to rest the elbow onto my thigh here. So I've got a platform here to work from, and then I'm just going to engage along the range of movement of abduction and extension at the same time while we engage the bulk of the tissue. So once again, passive release techniques. You've got to take your time, don't rush through this, let it work. Okay, come back again. So I'm just going to come down a little bit further. It's going to pick up a little bit more of this medial pec major, sorry. Make sure I get it right. So a little bit of extension and then into that abduction. Now keep in mind, this is really great stuff for swimmers as well. And obviously we were talking about before desk workers and so forth, so they have a lot of these postural changes as well. But this will be particularly helpful for Aaron. Okay, just one more sweep here. So again, extension. Yep, that's about it there, and then into abduction. Great, terrific. All right, now, second part of this is we want to get to that pec minor. Okay, so that obviously comes down here. Coracoid process, interesting little bony landmark, isn't it? Coracoid process, we have coracoid brachialis that comes down here. Obviously we have the pec major, and we also have the short header biceps. So we've got three muscles that come in and attach onto that small little bony protuberance. So that's actually really quite unusual. Okay, so what I'm going to do is I'm going to come around this way. I'm going to place the arm underneath mine here. So we're going to lift the shoulder up, okay, so I can relax off the pec major. Really important that that's nice and relaxed, because what I'm going to do is I'm going to come down and underneath the pec major so that I can pick up the pec minor. Okay, so we're coming down. I'm not anywhere near the auxiliary area, so we're just coming underneath the pec major. Okay, so we're underneath there, thumbs are there, hands go over the top, and then I can bring the tissue back down here, and now I should be sinking in right next to that pec minor. Okay, so it's at this point here that we start the release technique. Okay, so all I need to do is then come out to a bit of abduction and then just engage that pec minor. Okay, back down, pick up, and into that. How's that feel, Aaron? Not too much?
Not too much. Just enough.
Just enough, yeah. Which is exactly where we want to be working, okay? And this is a great technique to do for thoracic outlet syndrome as well because of that secondary entrapment, obviously scalenes being the primary. Okay, so 2 techniques. These are going to be great to go into your recipe toolbox when you're dealing with obviously shoulder problems, but also if we're talking about postural fatigue syndrome, desk workers and the like. All right, if you like that video, don't forget, click subscribe to the channel and check out premax.co, stuarthinds.com. Links are below.